My name is Lupe Castillo. I'm 58 and female.
Out of these listed, which ones do you have?
Type 2 diabetes, fluffy, obesity, fat, coronary heart disease. I need to be very careful, which sometimes I don't. Yeah, because sugar is one of the things that I crave a lot. So, and I always don't, follow the rules. But figure it's better a little bit than overloading. So,
Yeah.
than denying myself.
A lot of what Guadalupe is facing could be related to her diagnosis of diabetes and lifestyle. Being a Hispanic female in her 50s, Guadalupe is one of many in the same demographic to be experiencing these challenges. As we know, diabetes can also put an individual at higher risk of high blood pressure and other CVDs, as well as being overweight and inactive. Symptoms can often create a cyclical avoidance of physical activity. All right, since we are talking about the role of physical activity in preventing non-communicable diseases that our friend Guadalupe is experiencing, it is important to remember the modifications necessary for safety in these exercise sessions. Mainly, it is important to test blood glucose levels before and after exercise, as well as consult a doctor and or dietitian for advice on how to appropriately time medications and energy intake. As she mentioned, genetics does have a role in her susceptibility to mentioned diseases, but lifestyle, specifically daily moderate aerobic exercise such as walking, still has a large role in prevention and treatment of Guadalupe's diabetes as well as her high blood pressure, which we will discuss next. One can see that consistent physical activity levels decrease risk of type 2 diabetes by 6% for every 500 calories expended weekly. And even the order of activities can increase the positive effect of reducing blood glucose levels.
June of 2006, I had a heart attack, coronary artery disease where my right coronary artery was completely blocked due to the diabetes.
Cardiovascular disease is a group of diseases that involve the heart and/or blood vessels. At the last survey, 32 million women of Hispanic heritage suffered from CVD. Our client is one of them. During the interview, she mentioned that she also had high blood pressure and diabetes. Combined with CVD, that gave her a significant chance of having a heart attack and/or a stroke. Unfortunately, in the past, she really did have the heart attack, probably due to a combination of these factors. In order to best treat this, exercise and a healthy diet are very important, as well as avoiding smoking. Our client mentioned during the interview also that she had a hard time controlling her diet sometimes, and that exercise was difficult because she was embarrassed to sweat in public. In order to best treat this, we would probably prescribe extra exercise in an environment where she felt comfortable, and a calorie journal or something that she could use to monitor the amounts that she was taking in. Maintaining a healthy body weight is very important when you have CVD because a healthy body requires less energy to pump blood efficiently, which can take pressure off the heart.
Heart attack with the right artery totally closed and high blood pressure, that all came about little by little.
We also know that about 30% of people in Guadalupe's age group are experiencing hypertension, as well as 25% of Hispanics. Causes can often be related to physical activity and diet, but it is helpful that Guadalupe does not smoke. However, hypertension is a serious matter as it is often referred to as a silent killer because it increases the risk of stroke and other complications. There are often no warning signs. In participation in physical activity, it is most important to consult a doctor because of her various diagnoses and medications and her history of surgery. It would also be valuable to educate her in her target heart rate as to help see exactly how little work it may take to make improvements in blood pressure. To expand further on the effect of physical activity, being active lowers risk of high blood pressure by 24%. Along with this, it has been shown that 6 to 30 weeks of resistance training, which is valuable for not only women of her age, but also for weight loss, can significantly lower blood pressure.
I had a gastric bypass, which really helped I had lost like 25 pounds, but then I had a second rupture disc in my neck, which I had to have surgery, which they let the fluid out of the lap band while I was recuperating. It was 7 months, and yeah, since then it really hasn't been, it's been all downhill, gaining weight. Yeah.
And what kind was it?
I'm not sure. It's just,
sure.
it was, just a lap band.
As we continued to speak to Lupe about what she was doing to get a handle on her weight, she revealed to us that she had undergone bariatric surgery. When we look at bariatric surgery, we see that there's 3 different forms. There's the gastric band, the gastric bypass, and the gastrectomy. These type of surgeries are ideal for those who cannot lose weight through diet and exercise on their own, or who have serious health problems caused by obesity. Lupe seemed to be unclear about which surgery she had had, first mentioning that she had gastric bypass, and later mentioning that she had a lap band. Her daughter was later able to clarify that she does have the gastric band. A lack of information on which surgery she had can lead us to believe that she was ill-informed about the type of surgery and about the management. She later revealed that she had undergone complications, and this loss led for her to lose control of her weight and continue to increase weight once again. As we continued our research into the management of bariatric patients, we see that after surgery, there are many things that a person must be aware of. The bariatric patient must take in vitamins through supplements for the rest of their life. There's a nutritional plan that is given to the patient by the surgeon, and exercise is important to maintain a healthy weight after surgery. The surgery is not a miracle cure or a guarantee way to stay thin. It does help, but it requires changes to lifestyle to maintain. Alcohol and smoking are not recommended after surgery. Even after bariatric surgery, Hispanic weight loss appears lower than non-Hispanic white and African American cohorts.
I used to run 5 miles a day on my lunchtime on the treadmill, but then, what has it been, 7 years back, I had a total hysterectomy along with my ovaries. Can't take any kind of hormones because of the heart, and so now I have this sweating that just goes on all the time, and so I hate exercising because I get all sweaty and and heated.
Guadalupe has a history of exercise, and she used to be a runner and knows that she should be exercising and managing her diet for her conditions. However, she no longer likes feeling sweaty and does not manage her energy intake, and this can be common for people who have been inactive for an extended period of time. What she does have going for her is her past experience in muscle memory, her solid management of medication, and her knowledge of proper nutrition. So mainly, the focus is on motivation, as she has most of the tools necessary to at least start physical activity.
You know, to walk and keep moving, take the stairs, if there are stairs, which I will take down but not up. So, that's too much.
What about swimming? You're overheating.
I never thought about swimming.
I know that aerobics is very good. Exercising
I'm
is
already
easy on the
wet, so
Walking upstairs, but when Christina's friend suggested swimming, Guadalupe expressed that she hadn't thought of swimming and no one's ever mentioned it, so this could be something to explore. Taking all of this into consideration, the following plan has been put together addressing all current conditions. Swimming can be good on joints that may be in pain from diabetic symptoms or inactivity, but is also great for asthma because of the slow, even breathing. Resistance training could be combined with flexibility through yoga, since frequency is the same, and it would be an easier adjustment as to not overwhelm her with multiple activities. This can be done through a quicker, more active class like a vinyasa class with plenty of reps and a more moderate intensity, or she can participate in a slower, more comfortable practice, counting long breaths as repetitions and repeating postures that may be using larger muscle groups for sets. There are instructors that do one-on-one sessions tailored to specific needs, and for the time of exercise, mornings are better to avoid complications in dropping blood glucose levels, and later mornings are suggested for asthma. Frequency is a better focus than intensity in this case, shooting for most days for all 3 asthma, hypertension, and diabetes management alike. And again, we know that progression is an important component to all physical activity for health plans.
That's it.
Yeah. All right. Thank you.
Bye.